I see a lot of patients that come in, they complain of pain, like a mild or moderate pain on the front of their shoulder, right about here. And oftentimes it's just some sort of pec or bicep tendonitis, because your bicep actually comes up all the way over here and people don't really realize it. And most of the times they complain about it when they're working out or right after they work out. And this can be a lot of things. So overall, if you have pain with your shoulder, to be very comprehensive, you should see a physical therapist, because you have to look at the neck and the mid back and all parts of the shoulder, because it can be involved, and it could be something that might be a little bit more serious. But typically with most people, it's just some sort of tendonitis from working out. Usually the main reason that this hurts is a lot of times people's shoulders are too far forward. So if you're doing bicep curls or if you're doing bench press, you're over relying on these muscles in the front and you're overusing them. That's why they hurt a little bit more. So what you need to do oftentimes with most people is you want to strengthen the other muscles that attach to the shoulder blade back here. Because whenever you move your arm, if you're pushing or if you're doing bicep curls, your whole arm is anchored to the trunk, and the part of your arm that slides across the back is the shoulder blade right back here. So I'm going to show you 4 exercises that you can do to strengthen those muscles. So the first one is shoulder blade squeezes, just like this. You have your arm straight down and you're going to squeeze back just like that. You'll see, squeeze the shoulder blades back. Exercise number 2, similarly, it's just you're going to have your arms in a different position and you're going to do the same shoulder blade squeezes again. So if you look at the back, exercise number 3, you're going to get dumbbells. This is also a shoulder blade exercise. This is for the upper trap, okay? A lot of times people have soreness in their upper trap, so you have to keep in mind that this might make it a little bit more sore, but in order to fix the problem on the front of the shoulder, these are very important, because a lot of times your upper trap needs to be strengthened. So you're going to have your arms like this, and then you move your shoulders in a shrug type motion, and you're going to go up and back like that. You don't want to go straight up like that. You can do that, but for this particular exercise, you want to go up and back. The last one is for a muscle called the serratus anterior. Not as well known, but it attaches, it's almost in your armpit. It comes around from the shoulder blade and attaches to the ribs, and it's very important for stabilizing the shoulder. So you're going to get on the ground like this, or you can use a bench, and you keep the arm straight, keep the elbow straight, and you lift up like that. Let me do it in this arm. So elbow straight. So again, those are just a few exercises that you can try, and essentially we're strengthening a bunch of different muscles around the shoulder that are not in the front.